Here to te si Vivek kule. When I leng do mai kan neya Dr. Vivek Kumar ani hi DM Cardiology Apollo Hospital Delhi thokmek ani hi kan tak sapenga poimo lung Chungchang kan zo dona tin Mizoram aron kaldan te le helaya inange thoti te chung te chu voina kan zo chak don nia. So we have a very special guest and we'd like to welcome Dr. Vivek Kumar. Greetings.
Thank you, Mahfil.
Thank you for coming here. And he is a DM cardiology working in Apollo Hospital, Delhi. And we're going to learn about a very important muscle in our body, the heart, and the common procedures, and also the general well-being, how to take care of our heart. So we're so grateful to have you here.
First of all, Chibai to everybody, and thank you so much for having me here. And I must tell you that it's a great pleasure to be here at your show, and definitely would love to answer your questions regarding heart.
Thank you. So he's no stranger to Mizoram, and we're going to ask him all the details about that. But first of all, Dr. Vivek, if you could introduce yourself, why you're here, where you're based while you're here in Mizoram, please.
Oh, surely. So, Mahfil, so as you introduced me, that I am a senior consultant cardiologist at Indraprastha Apollo Hospitals, Delhi, where I do most of the advanced stuff there. And but for the last 3-4 years, I am coming here every month, staying for about a week or so, and trying to provide that cardiac care to people here at Mizoram, at Aizawl, in Trinity Hospital. And just to give you a background of that, Trinity Hospital, I think, has the best cath lab, or the best of a kind of a cath lab available here. And it's not only me, but some of my friends are also coming here. So mostly we are there almost around the month here, and where we provide advanced cardiac care as well as consultations to patients, and definitely guide them towards cure for their cardiac elements. So procedures like angiography, angioplasties, and even we have a cardiac surgeon coming to Trinity Hospital. So all these things are being done at Trinity Hospital, and I'll tell you, it's been such a remote kind of a place, and providing the cardiac care which is up to the world level, or up to the what you expect from any good center. I think it's really commendable that Trinity has all these things here.
That's wonderful. Dr. Vivek Khan, helai Mizorama lung enkol na cha khovela po atop te zinga mi kan ti thei tur chu tiang chu Trinity Hospital kal thangin kan nei thei hi alomom kan ti takze ta thatin ron kal thina Dr. Vivek hi Mizorama aron kal photo. How many times have you visited now so far? How long have you worked?
I don't know, maybe for the last 4 years I'm coming here. So every month I made sure that I come here every month without any break. Right. So I have to balance my work there at Apollo Hospital as well. Definitely a promise that has been done to this place, that okay, I'm there for their cardiac elements.
Right. Apollo Hospital rim taka tho chungin thatin chol mi alavin kumli chung Trinity Hospital lunglam enkol turin le Mizoram po ina phai rama kal kher ngai lova zo fati enkol na tha kan nei theinan helaya ahun ne tha te ron sing hi kan ngai lu tak zeta. So we're going to ask you just a few basic questions about how to take care of very important muscle in our body, pumping out blood throughout the whole body, and we know how important it is. How important is it, Dr. Vivek, to take care of the heart?
Well, to make it very simple, so heart is the organ that pumps blood all over the body, and imagine every minute on an average the heart beats about 70 or 80 per minute. Okay, so for a lifetime it's like it's continuously working, and it's pumping in a resting person about 5 liters of blood in a minute. So it is a huge task to do. Right. But it's very important to take care of this organ, because if this organ starts failing, all the body organs get affected, be it kidneys, be it the gut, brain, everything gets affected. So it's very important to take care of its health. And what we all know is that prevention is better than cure. So if you can prevent something from happening or being deranged, it's the best part. So prevention is easy, because we know there are 4 common factors that lead to a heart problem. They are smoking, having high blood sugar, that is diabetes, blood pressure, high blood pressure, and high cholesterol. So if somebody can take care of all these 4 factors, the chances of having acquired heart disease, which we call a coronary artery disease, that is getting blockages in the blood vessels of the heart, you can very well prevent that from happening.
That's very important. Thank you for that. Tuna aron soyang kanin he kan lung kan enkol chat laut chuan soyang kanin masala chuanin a thokrim bernia kan taksa atel lo chuanin adang kan taksa pek sang sang ya tuar the same em dona tin chung pali aron soy mezia zuk te le high blood pressure te le cholesterol high cholesterol te khang te kha kan nei chawani chuanin har sana disease tam ta kan nei chaw theya. So tell us more about those diseases, what the heart diseases that we can suffer if we don't take care of our heart properly.
So if I go from the beginning, okay. So the heart disease can be from birth or it can be acquired. So from birth, what we call it a congenital heart disease. So a pregnant female needs to really take care of certain things, that avoiding any unnecessary medicines, avoiding smoking or any kind of tobacco or something like that, you know. So they can affect the growing baby in the womb, okay. So that is how you can prevent congenital heart disease. So preventing heart disease in a newborn baby. So this is what we call congenital heart disease. But if you ask me, what commonly we see is what we call is a coronary artery disease. So these patients usually present with symptoms of shortness of breath or what we call angina, that is chest pain while doing some extrovert or strenuous activity. So this is the most common presentation of coronary artery disease. That what happens that the blood vessels, so heart needs blood to work, okay. So one thing is that it pumps blood all over the body, but at the same time it needs blood for itself, and that is supplied by what we call a coronary arteries. So the blood vessels of the heart are called coronary arteries. If they get blocked, people start getting symptoms of angina, that is chest pain on exertion, and shortness of breath, that is being breathless while doing things which were comfortably done about 3-4 years back, but now even walking or maybe climbing stairs gives some symptoms of breathlessness. So this is the common presentation of coronary artery disease. Additionally, one can have a problem in the heart valves. So we have 4 major valves in the heart: mitral valve, aortic valve, tricuspid valve, and the pulmonary valve. So these 4 also can get affected by some disease process and can cause problems.
Right. That was very, very informative. Thank you very much. And we learn about these things, I guess, in biology or things in school. But until and unless it's a practical thing, I think we don't register it as well. Tuna kan Dr. Soyang Khan, kan taksa, kan lung kan enkol chat lau chuan, nau pang tetan entirnan, nau pailai tepo ziazu ka wangten, nau pang effect heatin, tunua chuan a symptoms kan huang te chu entirnan hilai lungna te thok chat thelo te khang te kha heng disease internet te hi alone Dr. Vivek, how can we prevent ourselves from developing this disease? How can we take care of the heart?
So first and most important is that never neglect an abnormal symptom. Symptoms means feeling of a problem, like feeling of a chest pain, feeling of breathlessness, feeling of palpitation, that is feeling your heartbeat pumping fast, or giddiness. So don't ever neglect these symptoms. If anybody has these symptoms, they need to go to consult a cardiologist, or if he's not available, maybe a physician, and get some basic tests done. The most common test that is which is routinely done and is widely accepted is electrocardiogram, ECG. So that gives a lot of information. Additionally, one can be advised echocardiogram that sees the heart pumping, okay, and it can see whether the valves are having problem, the pumping is appropriate or not. So these are the basic tests that needs to be done to prevent or to know about the status of cardiac issue that may be present. So apart from that, as I said that you asked about preventing this problem. So prevention is that having a good lifestyle, a lifestyle which has half an hour or something of a daily life devoted to exercise, doing workouts. That's very important. Having a lifestyle which has a healthy food there, a balanced food, avoid a lot of oily stuff, sugary stuff, and smoking is very important. And unfortunately, I see a lot of mijo guys and girls indulging in that, and I tell you, we have ample data that smoking causes heart problems. So if you want to prevent these problems to happen, you need a good lifestyle.
Yes.
A lifestyle with a balanced food, a lifestyle with a regular exercise component, and avoiding indulgence in things like smoking. So this is how you can prevent.
Thank you so much. And that's very important advice. And Dr. Nasoyang Khan, kan nung hi shisel tura kan do chuan lifestyle kan nun phung hi kan thak dang la mangai na same emazuk le buama in sum te tin exercise that te tarkar chan ve bor vel tal chuni tin hi han che that tum te le kan e le in a te a thum a al a mom kan e za thina ma se kan in sum za to thura ni ti lai ka kan chin cha chu lo me. Thank you so much for that. And asoi tel bo ka chu e kan enge mo symptoms kan neya kan shia ni chuan thinna te lungphurang lutuk anga kan shia te kan in entir fat hi athabera. And how does Trinity provide that care for us in Trinity Hospital? You will be there taking care of all of those things. ECG te poka ati theya khangmang te poka in Trinity Hospital and entir theidona. So what are the process of getting yourself checked up?
So obviously we have cardiologists at Trinity Hospital. So with me there are 3-4 people, or it's people coming to Trinity Hospital, the cardiologist coming to, and we have all this set up at Trinity Hospital. So Trinity has obviously ECG, echocardiogram, and they have Holter, treadmill test, and more importantly they have a very advanced cardiac cath lab. So cardiac cath lab is a place, and apart from that, that they have a good CT machine there. So a CT coronary angiography can also be done. So cath lab becomes very important component of giving treatment to such patients, because this is the place where you can do angiograms and if needed angioplasty, that is procedure to treat a blood vessel. This is called angioplasty. Apart from that, pacemakers can be put there. So all these facilities are there, and I tell you, the nursing staff, the CCU is where the people working there are very competent. So this morning I did a case and I'm come here for your interview, but I am relaxed because I know that there are people taking care of taking good care of the patient, which we do a procedure if needed.
Right.
So in that regard, I think Trinity has a score of 10 out of 10, I tell, and they have very good infrastructure actually there.
And I don't believe this is available anywhere else in Mizoram, is it?
Can't say about that. I mean, not roamed around Trinity, and I not roamed around Aizawl, but I'm not sure whether all other hospitals are there. But what I can say that the Trinity is pioneer in that regard.
And you are training other doctors as well, or they're just learning under your guidance?
So whenever we come, and obviously knowledge increases if you share. So this is what we, and I strongly believe in. So there are people, people who are doctors there, the physicians there, and even a cardiologist is there, which is based permanently in Aizawl. So we try to share our knowledges and try to help each other in the procedures as well as understanding various case scenarios. So we try to help each other, and definitely the main aim is to deliver good and great cardiac care to the patients here.
That's wonderful. Tu na rusu yang kan kasoi dik lau cuk shila ajar mzong so ka angioplasty ti te like hi bung roa man roa chuan in athaber pe Trinity Hospital hian an kola chawang chaw voin interview tur po hian in enkol zo chiat nuwa thamuang takin doctor dang te pon an lo enkol tha thei don ani ti shia in interview te po aron nei theya chawang chuan in khalama har sat na nei te le in enkol ngai te chu Trinity Hospital a kan in enkol thei ni ti kha le thamuang takin enkol na tha kan dong thei ni ti in kan kal thei ni ti kha min shil bol bola chuwang chuan pantla kan ni ti kha kan lo chin chia don ya. And I guess this is basic questions for people that might not understand the process of taking care of yourself and how to get treatment and the treatment options. Is it a scary process of getting those treatments taken? So if you could just walk us through on how to get treated.
So I tell you first of all that if you have a good cardiologist taking care of the patient, it's not a scary procedure. So the thing is that what are the common procedures that we do?
Yes.
So we do an angiography. So angiography is a procedure which is to see how the blood vessels of the heart are, the coronary arteries. The blood vessels of the heart are called coronary arteries. So if you ask me how it is done, then coronary angiogram is done under local anesthesia when the patient is fully awake. Okay. We either take an access from the forearm. We call it a radial artery. There is a blood vessel that goes straight to the heart.
Right.
And in some people, we may need to go through the groin, the femoral artery. So what we do is that we put a small cannula, which is round about 2 millimeters in diameter, and through that we take an access either from the radial artery or the artery from the groin, and we take in a wire. Along with that, we take a tube and we place it position it at a place where the heart blood vessels arise. So heart blood vessels are the first vessel coming out from the aorta. So basically, you have two set of blood vessels. The one is the left coronary artery and the other is the right coronary artery. So we engage one by one each of them. We inject a dye and we see the flow in the blood vessel. At any place, if there is a blockage, we will see narrowing of the flow. And this is how we ascertain that somebody is having a blockage in the blood vessels. So the whole procedure is almost painless apart from the access.
Yes.
Patient is fully awake. Roughly the time taken would be around 15 to 30 minutes. That's it. After that, if no other procedure is needed, patient can even get a discharge after 3 to 4 hours. So how smooth it goes. So this is what we call coronary angiography.
Right.
Then if suppose you have a situation where you have a blockage in the blood vessels, in that situation we need to treat it, because logically if the blood vessel is having a blockage, the heart is not getting enough of nutrition in form of oxygen and glucose, whatever it needs to work. So by logic you need to improve that nutritional state of the heart, and that can only be done if you treat the blockage, that is you open up the blockage.
Yes.
So one technique which we intervention cardiologists do is that from that very access and the tube, we pass in a wire and we cross the blockage. Then we take a balloon which can be inflated, and we go at a place where the blockage is and we inflate the balloon. What it does is that it cleans up the blockage.
Right.
And we can put a mesh of a stent there to support the blood vessel. So this is what we call angioplasty. That is angioplasty plus stenting. That is treating the blocked vessel through a balloon followed by a stent. This is what we call angioplasty and stenting. But some patients can have multiple blockages which may not be well treated by an angioplasty. These patients, we recommend that they go for a open heart surgery, what we call commonly as a bypass surgery. So this is the common procedures, and yes, bypass surgery is done by the cardiothoracic surgeon, and that is a very extreme or a very demanding surgery. But angiography and angioplasty relatively painless, and usually the procedure lasts about 30 minutes to 1 hour if I talk about angioplasty. and patient can get discharged the next day. So it's not such a, what you can say, that it's a very hassle procedure. It's a smooth procedure if done properly.
All right, thank you so much. So we've just been informed about angiography, angioplasty, and open heart surgery. Kang surgery shang it enkol na shang ka atira chuan in mahlo tur lova han na don bok lova are bok lova chuan in enkol na cha kan nei theila hianin hlau thon na kan nei ni chuan Trinity Hospital lama in enkol na hi bo vat acha in ka sia a chuk te chu kan doctor kal tlangi na process shang kan sia. How does the heart artery get blocked? How does the blockage happen?
That's very important question. So, as I pointed in the beginning of our interview, that the blood vessels, is a preventable cause. I mean, the blockage of the arteries can be prevented. So, I enumerated 4 causes: smoking, high blood pressure, diabetes, that is high blood sugar, and cholesterol. So, basically, if you ask me how it is blocked, so what happens is that gradually you have deposits of cholesterol in the blood vessels, and as it builds up, there is more of a fiber deposition there, and as well as calcium deposit. Sometimes the blood vessels can get suddenly blocked. We call it a heart attack. So if somebody is having a blockage, it can give that person angina, that is symptoms of blocked blood vessel. But when it gets 100% blocked, we call it a heart attack. So initially there is a cholesterol deposit, and thereafter there can be a clot formation in that that causes a heart attack.
Right. That is a very important kind of explanation. Hey, can Doctor here, I feel like I'm having a really good lesson. I would love to have you as a teacher, maybe when I was doing my biology classes. So this is really helpful. Can Doctor say, blockage hi alo full blockage hian 100% blockage hian heart attack kami kan shiatlar lo thu thina hi atheng thea chung a ven nan chuan kan blood pressure te in cholesterol level te khang song song kha hei zuk lem huam in sum ka tlang te po hian in anei the kan in kal tlang te po in chuwang chuanin khang kha heart attack athen lo nan chuanin kan in ven he poimo in ven the ani ti kha shiata tha le ome. There's an open heart surgery. We talked a little bit about open heart surgery. How many? It's a very serious case, and do we have many cases here in Mizoram?
Fortunately, I think for that I can say that Trinity is the only center which has a bypass OT. I mean, they have heart-lung machine which is needed for bypass surgery, and a good number of bypass operations have been done at Trinity Hospital. This is what I know. So it's available at Trinity Hospital, the bypass surgery, and a good number of cases have been done here.
Okay, that's good. And can you walk us through the process of an open heart surgery?
So in an open heart surgery, as the word is bypass surgery. In bypass means to bypass a blockage.
Right.
What the surgeons do in this is that they open up the chest bone, which we call the sternum, expose the heart, and they put artificial conduits. They either make a conduit in the heart, in the chest itself, which we call it a internal mammary artery. So they dissect it out and put it at a place which is distal to the blockage. So when a blood vessel is blocked, there is no blood vessel going beyond it. Right. So if you create a bypass channel and place it here, the blood will start flowing in that segment.
Right.
And this is what we call it a bypass surgery.
Okay.
So usually the procedure can take about 3 to 4 hours. Patient needs full, patient is put on mechanical ventilation. The chest is opened up. The blood vessels, the conduits are made. Either a natural conduit is used, which is an artery present in the chest, or a vein is taken out from the legs, and it is placed. One end is connected to the aorta, which is the main conduit coming out from the heart, and the other point is placed just beyond the blockage. So this is what a bypass surgery is.
Right. Open heart surgery is a bypass surgery. Ti pon lo say china to na process so yang kanin hi chu a serious tak no a enge har sa na lian kan lunga kan tong na surgery Trinity nan pek thaya ni a chu engkima facility hi Trinity Hospital a veka chutiang din mun lau thon kan thlenga ni pon in enkol na omani ti kha min sha tira lom hle maya. And what is the success rate of this surgery? Is it,
you mean to say bypass surgery?
Yes.
So there is a risk element associated with it. So if you ask me what is the risk for a normal angioplasty, so I'll say it is roughly 1%. That is, one can, if we do angioplasties in 100 patients, one patient can have a serious complication. But for bypass, it can be somewhere in the range of 2 to 5%.
Okay. That's not
because
high.
That's not high, but yes, that should be seen in a perspective of that if somebody is having serious blockages, anyways that patient is going to succumb to that in coming years. So that is 100% risk. So if there is a treatment which gives you something to be safe of, and at a risk of about 2 to 5%, that is worth a risk to be taken. Otherwise, it's 100% risk. If you leave your blood vessels like that, it's going to have its impact, and most of the people don't survive a lot. So we need to treat it. So whatever the risk chances are there, it's a risk worth taking.
Yes, of course.
Yeah.
In enkol na hi tam tak hi chaw kan hlau thina surgery te hi kan hlau em thina mi tam tak chuanin Natna har sana tok chung point hospital te kan pan she thina ni amai ro chu kan nun na ta na hlau om thil omani chuanin in enkol na thluk om lawa a risk factor te po entirna a hlotin na chance asang em ani ti khatuna khanin kan doctor min shil ang khan henglam har sana kan nei ni chuan in enkol fat thluk om lo ti kha kan lo chin chha don nya. And we'll come to maybe one of the last questions, and then if you have anything else to share, then we can also open up the floor for that as well. We have a lot of treatment options that you mentioned, but what are the advanced treatment options that we have here in Mizoram that won't be available maybe elsewhere, or the same level of treatment that we can have here that is also available in Delhi or any other prestigious hospital that we have in India?
Okay, so as I said that here we angiography, angioplasties, bypass surgery is available, pacemakers can be done. Apart from that, we have done cases like what we call CRTD, that is what we call a cardiac resynchronization therapy. So it's not done at a lot of centers because you need trained people for that. And I'll say fortunately that I'm trained for doing that. So we did a case about I think 6-7 months back, and the patient is doing great. So this procedure is like salvaging a lost heart. So a lot of time the pumping becomes very less, so much so that the patient is not able to even do the routine activities of life. And in that condition, the heart's pumping can be optimized by doing what we call a resynchronization therapy, CRT. And additionally, we can put a ICD device. So I guess you are aware that a lot of cardiac patients, they die suddenly. I mean, you must have come across a lot of videos of people playing badminton or maybe dancing and suddenly collapsing and dying, which we call a cardiac arrest and cardiac death, sudden cardiac death. These things happen because the heart suddenly becomes erratic in its movement. I mean, so if you keep your hands over your heart and you can feel that rhythm, the heart has a very beautiful rhythm. It beats regularly. The intervals are fixed. So a lot of at times this can become erratic, and this leads to cardiac arrest. We have a device we call automatic intracardiac defibrillator. So it's a defibrillating device that can be placed like a pacemaker, and if somebody gets this erratic movements of the heart, it can sense it and give a shock to the heart, and this helps to prevent sudden cardiac death. So this can be done. Additionally, we have advanced treatment for valve surgery. As you know that elderly patients, they are not a good candidate for open heart surgeries, right? So suppose if somebody has a aortic valve which is diseased and it needs a replacement. And the patient is not a good candidate for open heart surgery. You know, patient is frail, low in weight, maybe having other problems like kidney problems, liver problems. Such patients are not good candidates for open heart surgery. What we can do in this patient is that we call TAVI, that is a transcatheter valve implantation.
Right.
So it's a procedure which is done like an angioplasty without open heart surgery.
Right.
So this can be done,
Okay.
what we call a TAVI. Additionally, we have a very new treatment for blood pressure. We call it a renal denervation therapy.
Okay.
And it can be done here also. So what lot of time you must have encountered that hypertension patients with high BP, they may be taking 3 or 4 medicines, the BP is still out of control. For such patients, we have this beautiful treatment, we call it a renal denervation therapy, and it is also done like an angioplasty. So minimally access, local anesthesia, patient is awake, and we can do this procedure.
Right.
So these are the advanced procedures that are available, and it can be done in patients. So valve surgery in a very elderly patient, very high risk patient, we can do a transcatheter, that is through a tube, we can change the valve. And for blood pressure patients, we can do what we call a renal denervation therapy. That is, we can control the blood pressure by ablating the nerves going to the kidneys. Okay, so this helps to control the blood pressure. So these are the advanced things that can be done.
That's wonderful. That's so comforting to hear as well. Tuna kan Dr. Sayang kanin treatment Chungchang advanced treatment te po kan nito angioplasty.
TAVI.
I can't remember the names.
So it's a transcatheter
Yes,
valve implantation for the valve surgery.
Yes.
And renal denervation
therapy
for blood pressure, high blood pressure.
BP sang neite le chung har sa na sang tina open heart surgery nei tura kum lama upalutuk le kha tak satin lo tur tan po khanin treatment option dang a omani ti kha kan doctor in min sia ti ra chu wang chuanin lau thong lovin khang har sa na kan neya BP sang lu tuk dam doi pali chili chuang e to ina khami a control thelo tan po khan in enkol na ha omani ti kha min sia ti ra chung chu Trinity Hospital a khanin kan nei the vet dona heng advanced treatment option kan nei the lai hianin lo pan nge la thatti na ron kal china. Anything else you would like to add on top of everything that we've shared? Maybe something a bit more education that the viewers might
I just want to re-emphasize that to your viewers that heart disease is very much preventable. Having a good lifestyle, avoiding smoking, taking care of the blood pressure and the blood sugar, making sure that the cholesterol levels are good. These are very important to prevent heart disease. But yes, if somebody unfortunately gets a heart attack or something, in that time it's very important to reach to the best center which is available. And I think Trinity is that regard is one of the best centers here, I'll tell you. And get it treated properly. And that is, so don't don't keep a lag in treatment. I mean, if there is a heart problem, get it treated as soon as possible because it will not give a second chance.
Right. So we talked about heart attack, and I think that's a very, very important topic here. We have a lot of, even those amongst the youth, developing heart attack suddenly. We are losing quite a number of lives due to that. How can we prevent that, and how do we know we're developing symptoms of a heart attack?
I feel that is a very important question to ask, and you're very right. Not here, worldwide, and more in India, people are dying because of heart attack. A lot of time, the problem is that people are not aware of the symptoms of heart attack, and they play it down. I mean, they think that it's something else, something very innocuous, but it could be very serious. So the most common symptom that we see in a heart attack patient is that they may have a sudden onset, so mark my words, sudden onset. That suddenly somebody starts developing a chest discomfort. So a chest discomfort which is like somebody is stabbing, that somebody is stabbing, or it's like a squeezing feeling, or it may be just heaviness over the chest. Particularly on the center and the left side of the chest. If somebody is having this kind of a symptom, which is sudden in onset. And at times it can radiate to the left arm, bilateral shoulders, even the jaws. This could be the first symptoms of heart attack. If with the onset, the patient starts developing giddiness, feeling of profound weakness, or if the symptoms goes, it goes away and then comes back again. We call it an unstable angina. Okay. So this is a very important symptom that should not be neglected. But mind you, a lot of time elderly patients and particularly diabetic patients, they don't feel like this. Only feeling they will have is that feeling of bloating. They say that we are feeling like a gas. In 50% of patients who are elderly or diabetic, they don't feel this kind of a symptom, the typical that I told you, that feeling of chest heaviness, squeezing, radiating to the left arm, shoulder or jaws. They will just tell that suddenly I started having gas with irritations. So and if this is associated with a lot of diaphoresis, like sweating, feeling of weakness, giddiness, this is a serious symptom of heart attack.
Right.
The patient should go immediately to a center which has a cath lab available, which has a cardiologist available, which Trinity has, I'll tell you, and immediate ECG is needed. Patients are given blood thinners for that, because as I said, that heart attack happens when the blood vessels get blocked by a clot. The blood vessels gets 100% blocked because of a clot. So you need blood thinners for that. So we give blood thinners to the patient, and without a delay, patient should be taken into the cath lab. Angiography should be done to identify what blood vessel has got 100% blocked, and the next step is opening up that blood vessel with angioplasty. So this is what the heart attack symptoms are,
right,
and what is to be needed.
Thank you so much. Hey, tunlai kan rama ponia kan chalai tia ponia lung putzol thi tia news te po kan chef wa tiang heart attack ka aron thleng thut thina ni e thleng thut te po oma in ven man lo te po kan soi thin amai ro chu symptom sang sang tu na kan doctor soyang khan kan om na te le kan ban na te nunglam te jawline borvela na te tin kum upalam le big takin bp nei sa chuanin khang symptoms kha kan nei kherlo mai thei ti te kha soi langa chuwan chong ko por te bloating kan ti khalama harsana kan ne tin thanta le chau lutuk ang chi khatiang te ron thlen thup thu te khanin in encolate entir vat hi apoimo em ani ti kha cardiologist pan vat apoimo ni ti kha min sha ti ra chuwang chuanin heart attack hi thil la kan lungta na thil la takani ti kan sha theu kha khatiang thil poi thui a thlen lo nan khan in encol vat symptoms kan nei ni chuan ngai enge a holu tu khei chu a thleng thira lom ti a ngai samna khanin kan nun hian min chan ti theini ti sha in Trinity Hospital ate po khang treatment omate kha kan bo zui vat kan bo vat ngai ti kha kan doctor in min sha ti ra kha kan lo chin sia ta donya. Thank you so much for visiting Mizoram every month to make these treatments possible for us and providing the training to all of these doctors that we have here. And we can expect you to come every month for the future as well?
Definitely, without a pause.
Yes. Thank you so much. And I hope you've enjoyed your stay here in Mizoram.
Definitely. It's a beautiful place and you don't see such greenery and hills anywhere. And
yes.
I love this place. And it's pleasure to be, and I tell you, I love Mizo people. They are always smiling like you are doing at this moment. So it's good to be here, and definitely I'll be here every month.
That's so comforting to know. And just for our last words, we have a Bible verse that says, guard your heart above all things, because everything you do flows from it. Kan Bible tsara po kan share kan tinlung hi kan veng thaber turania engki meta changa chwa kan wagin. So from a scientific perspective, from a health perspective, it is very important to guard and take care of our hearts. And thank you, Dr. Vivek, for being a very important instrument for that. May God bless you.
Yeah, thank you so much. It is a pleasure to be here, and it was nice talking to you. Yes. Thank you so much.
Thank you so much. Kan lome.